For the treatment, it will depend on the stage of the disease. So if a disease is localized and we believe that there's a hope for curative intent, most of the time surgery will be part of the treatment plan. And then before the surgery, mostly there will be a treatment indicated that we call neoadjuvant. So those treatment could be either with chemotherapy alone or with chemoradiation, depending on the choice of the medical team who will look at the imaging and the other characteristic of the tumor in the patient to make the best decision. There is as well sometimes study protocol that could also be indicated. Once the surgery is done, depending on the protocol that was used, there could be more chemotherapy afterwards, or sometimes immunotherapy, depending on the results of the pathology specimen after the surgery. In some cases, the disease is not operable, or the patient has comorbidities that don't allow a surgical act. However, the disease is still contained, and sometimes we can still aim for a curative intent with chemoradiation that we call radical chemoradiation. And lastly, for patients that have a more advanced disease or disease with metastasis for a stage 4 disease, the intent is to try to control the cancer, prevent it from progressing, allowing us more time for the patient, and also hoping to have better control of their symptoms to alleviate them from the symptoms they might have. So in those cases, most of the time, it will be a chemotherapy with added immunotherapy or other target therapy, depending on the pathology and the molecular testing that will be done on the biopsies of the tumor. And in some cases, more advanced cases, we can also sometimes use radiation for palliative, either on the primary tumor or on metastasis that cause pain, and sometimes use what we call a stent to open up the esophagus to allow patients to better eat.